All right, let me cue it up here.
Okay, perfect. Thanks. So after the live debugging of slides, thanks for having me here. As Andrea said, I'm a faculty member at Carnegie Mellon, and I've kind of worked at the intersection of all the AI buzzwords and all the policy social impact buzzwords. So all of the fun things. So generally the type of work, a lot of my, I guess, my work on a lot of my work is with state and local agencies, as well as federal and other countries that are better than the U.S. In a lot of ways. So I work with health departments. I work with school districts, transportation, human services agencies, both at the city, county, state levels. And then I based on sort of that work. So the idea there is to help those agencies build systems that are tackling kind of specific problems, and I'll kind of talk about that, but sort of building and deploying and evaluating AI systems to support different functions. And on the so actually, let me just sort of jump into some of the examples. So what I thought I would do is really do a kind of a lessons type talk. I'll kind of give you different lessons around sort of the developing, if you're building an AI tool for let's say health, public health use cases, designing them, using them, or focusing on evaluation or governance. So just gonna kind of highlight some of I'll give you some examples, both from kind of the older days of sort of more machine learning type things, and then some of the newer days. So if you go to the next slide, this is from 10 years ago, actually, or more than 10 years ago, like 12 years ago. It took multiple years to do, but this was some work that we did in Chicago, starting in about 2013. And this was around lead poisoning, where, and it's still the case, I think, in most city, county, states, where our approach to lead poisoning is relatively reactive, right? We wait until kids get lead poisoning, and then we go fix the problem. In fact, actually, once I was talking to an agency in Seattle, and their claim was that there is no lead poisoning in Seattle. Why? Because we don't test for that. So if we don't test for it, does it exist? And if we tested for it, we might find out that it exists. And then we have to do something about it. And so the way Chicago would do is they would test kids before they go to school. And if they found a kid at elevated levels of lead in their blood, then they would send an inspection team to go to their house to check for lead hazards. And guess what? 95% of the time, they found lead hazards, because how else would the kid get lead poisoning? And then they would figure out how to remediate that. The problem, lead poisoning effects are not reversible, so it's too late. So we worked with them to build a system that would take data about the child, the parents, the house, the neighborhood, and use that to identify or predict which kids are going to get lead poisoning, but do it when they're 2 months, 3 months old, so that by the time they're crawling, we have fixed the problem proactively. So that system was built, evaluated, deployed in Chicago. So this next slide. So that's kind of one example from the old days. This is some more recent work. So this was some work we're doing in Kansas with a couple of counties, Johnson and Douglas, the kind of border of Kansas and Missouri. The initial work with them was around reducing jail rebookings, people who've been in jail before, then they're being released. We want to reduce that, but through mental health intervention. So they had a team that was called the crisis response team, mental health crisis response team, and what they would do is they would go out and try to outreach everyone who's been released from jail in the over the few days after they've been released, to kind of connect them with different services and needs that they have. And what they had limited resources. The question was, can we use these outreach? Can we figure out who we want to focus on in order to reduce their risk of coming back to jail? And so I'll kind of talk more about that system, but we kind of built the system to help them do that, evaluated that, showed that actually it did reduce things, those things. And so what we were now been working with them for the last 2 years is extending that not just as a tool to reduce jail rebookings, but as a tool to kind of improve overall behavioral and mental health. So reducing, instead of being reactive and responding to 911 calls or referrals from police or jail or other sources, can we be proactive and figure out who's going to have a crisis over the next, let's say a few months, and getting them connected with the services they need before that actually happens. And that system is now, we're running a trial right now with them to evaluate how much it does that. So next slide this is some work we were doing. Started just, it was like 5 years ago, like just before COVID, ran through COVID, which was with Mexico, around vaccination rates in children. So the vaccination rates there are relatively low, not because of the crazy reasons in the US, but because of lack of supply, lack of access, lack of awareness. And so the idea there was, again, like, if we can identify which kids are going to be at risk of not getting vaccinated early, then we can figure out whether we want to do outreach, whether the parents are coming to the hospital for some other reason, we can kind of intervene at that point. And if instead of waiting till later, and I'll talk about why this was an interesting use case where a very simple solution worked as good as well as a much more complicated AI solution there. So next slide. This is some work we're actually doing now. So CMU, where I am, is in Pittsburgh, which is in Allegheny County. This is some work we're doing with the County Human Services Agency on taking people who are facing evictions today. When somebody's facing an eviction from their rental housing, they can call a phone number, or they can go to this service center in downtown and ask for help, ask for rental assistance. And today, it's very much a reactive, first come, first serve system. You call, and if they have money left and you meet the eligibility criteria, you get the money. Except a lot of people are being left behind. So what they want to do is use the rental assistance money, limited rental assistance money, as a tool to not just help people, but really prevent homelessness. So they want to prioritize people who are likely to become homeless, because they have to have some way of doing. And so what we've been working with them is building that system. So right now that system basically generates a list of people every week that goes to an outreach team. That outreach team starts proactively contacting people instead of relying on them and waiting for them to call, and kind of walks them through the application process and starts that rental assistance application and so early result. Right now we've been running, again, an evaluation, a trial over the last 6 months with them, and kind of starting to get some early results there. Next slide. This is a very different example. I was kind of giving you a very wide variety of things. This is some work we were doing in India, where there's pollution for many reasons, but in some of the urban areas, Delhi, for example, the big source of pollution is there's a lot of even though it's an urban center, there's a lot of farming in the surroundings. And one of the things that they do is when they've harvested the crops, they have to clear the fields in order to plant the next set of crops. And the cheapest way to clear the field is to burn it. And it's more expensive to actually go out and take things out. So a lot of the farmers there burn, the stubble kind of after the things have been harvested, such as rice, and that's one of the major sources of pollution. The problem is that the governments and the nonprofits, there's a lot of nonprofits that are working on reducing that and trying to find different mechanisms for reducing it. But they have no way of knowing the impact of that work, because there's no data on what's being burnt, when, where, for how long. So they're just kind of anecdotally collecting this information because there's no systematic way of doing that. So what we're working with them on is using satellite imagery to detect when crop burn. one, trying to find out where there's not even an inventory, a database of farms. It's just, everything is just there. So we're using satellite imagery to detect where things are being planted, what those things are, when there is a fire in those fields, how large is it, how long, when, to collect data that can then be used downstream for doing policy evaluation and monitoring. So next slide. I wonder what example. This is some work actually in similar, very different, similar technology, very different use case. This is Baltimore. There's a lot of kind of vacant row homes in Baltimore. And one of the challenges that they're facing is a lot of them have roof damage. And one, roof damage is really hard to detect because when you're walking, you don't see the roof damage. Two, it's not just bad for the home that has roof damage because of these row homes, because row homes are connected. Roof damage in one unit leads to the entire kind of block being at risk. So the work with them was, so what they did was a couple of years back, they got access to, sorry, the sun is coming into, they got access to, they worked with a company that collects aerial imagery. So they fly drones over places and collect aerial imagery. Actually, the main use case for that, the main customers of that company are, people who sell you roof. They'll kind of send you in the mail thing, hey, your roof is damaged, so we need, but they do it manually, right? So what they did, they got that data and they got a couple of interns to look through that data and find roof damage. And they took them about a year to do that for the city. By that time, the data was old and obsolete, so they had to do it again. So we kind of helped them build an AI system that could take both the imagery, but also the administrative data that they have about inspections, about the housing, and use that to identify, kind of score these buildings on the extent of roof damage, so they can then start trying to figure out whether they need to do stabilization, safety inspections, things like that. Next slide. This is, I'll quickly mention, this is some work we did again a while ago with several police departments on helping them identify which police officers are going to do horrible things like, unjustified use of force and shootings and that system is now kind of deployed in a few different places. Seattle was actually one of the cities that was interested in doing it, but they never really got there. They started doing it with a company, and they got to the data integration piece and kind of ran out of money by the time the data integration piece was. They never actually got to building anything. But the system we kind of built was deployed in Charlotte, Nashville, and a few other places. Next slide. Let's see, I'm going to skip through this. Lots of sort of housing, lots of inspection type problems. Another where you have limited resources and you have this many things to inspect, whether it's restaurants or housing safety or workplace safety or compliance, what used to be known as the EPA, the organization. So there are lots of sort of use cases there. Next slide. So I think one, kind of stepping back a little bit to these use cases, they're kind of, all of these have sort of a few characteristics in common, right? One is none of them are kind of trying to do automated things. They're kind of supporting people who are trying to sort of help somebody, whether it's caseworkers, mental health workers, outreach. And the goal is not to sort of automation, the goal is collaboration. And that's important because the next step is then often, pretty much, all of us kind of live in or work in environments where you have limited resources. If you had enough money to give everyone rental assistance, you wouldn't need AI. If you had enough money to sort of inspect every home proactively and fix the problem, you wouldn't need any machine learning, any AI. But unfortunately, that's not where we are. So that allocation of limited resource issue kind of leads to kind of the next piece, which is you're sort of trading off a lot of these different goals. And that's where kind of a lot of issues come in when using machine learning and AI is if you design a system to be efficient, which kind of means, I want to maximize, I have this much money, maximize the number of people you can help with it. Well, these AI tools, if you tell them to do that, the only thing they can do is help the people who are cheapest or easiest to help, because that's what you asked for. Um, but that means they're going to leave behind people who are harder or more expensive to help, and that leads to inequities. And so a lot of the underlying issues with AI, and both the issues but also the value, comes from we as kind of on the policy side coming up with what we want. What do we want this thing to do? And then translating that policy need into technical choices that these tools then get built or configured for, and then implementing them. But that there's sort of often a disconnect over there, where we never talk about those goals and values on the policy side explicitly. There have been many cases where we've had these conversations with different, on the policy side, and say, oh, we don't want to make that decision. Who do you want to prioritize? Everybody. Do you have money to prioritize everybody? No. So who do you prioritize today? We don't know. We like whoever calls first. Okay, so you've decided that your goal is efficiency because you don't want to spend money on finding people through outreach. You just want to wait till they get to you and you help them and they come to you. So that's what you already kind of made that decision, but it's not explicit. So when you now use an AI tool to replicate that, all it's going to do is just replicate your existing process. So if you want to change that, then, and we'll talk about a little bit, some of the examples of when that happened. So I think that's kind of a very key issue that we see repeatedly. If you go to the next slide, here are kind of some sort of base level things that you've probably, but I want to just repeat them in case, I think one thing is we're sort of seeing, right, that there is a lot of opportunity with AI tools today, where a lot of these AI systems can do things that people were good at. But I think one thing to keep in mind is that they can do very specific things under very specific conditions. They're not a general purpose, despite what GPT stands for. A general purpose transformer. It is not a general purpose transformer. That's just the marketing behind it. They can do very specific things under very specific conditions. When you take them out of their comfort zone, they start doing crazy things, as probably you all have seen examples of. You start typing the same word over and over and over again in any of these chatbots, and they start giving you gibberish. So that's kind of that's one important thing. Second thing is, as you've all seen again, these systems are heavily dependent on data. And so when things don't work, what we often do is sort of the excuse is, well, it just doesn't have enough data. If we just gave it the right data, if we fix the data problem, if we've got representative data, if we got diverse data, it's going to fix all problems. And actually, it's not true. The data is a problem, but good data is necessary, but not sufficient. The thing that AI systems are most dependent on is really humans, unfortunately. In the future, hopefully, fortunately, but right now, unfortunately, because a lot of these AI systems require hundreds, if not thousands, of choices to be made when they're being designed. And those choices are being made by the people who are designing them. They're typically engineers. And so they're making choices that they're not trained to make. They're making policy choices. They're making, value choices. And most of them are not making them explicitly. They're kind of making them implicitly. Some tool developer builds a tool. They have to pick some value to put in there. And so they just put in like, oh, I just care about every person is equal. Like, okay, so I'm going to prioritize people based on where I can, so if you I want to focus on people where they're high density because everybody's equal. If I help the most people, I get more points. So I think one of the things that for example, the other thing that all of these tools end up making choices on is, when you build the system, you tell it it's going to make mistakes, and so the designer has to tell them what mistakes matter more. And based on that, it starts learning what ends up happening. So So if you go to the next slide, I'll actually jump into a couple other things quickly, and then okay. So I think so. This is kind of the main thing, right? A lot of these models, all the decisions are being made. Who matters more? What mistakes can you make? What do you care more about? So if you click, actually, it's going to animate that. For example, if you care about efficiency, you're going to sort of have it be prioritizing. I want to make sure that I allocate resources to people who are going to be at risk of something, homelessness, lead poisoning, going back to jail. But it may be that you can't change those outcomes with the program that you have. And so if you care about reducing homelessness rate or lead poisoning or jail rebooking rate, you might want to pick a different set of people, and that's going to be a different system. But that doesn't mean you might reduce overall homelessness rate, but you might increase disparities. So if you actually care about reducing disparities, then it's a different set of decisions you have to make. And upfront in when you're buying or configuring or building these systems, you have to make these choices. What do you want the system to do? Do you want it to be to increase your efficiency at allocating resources? Do you want it to improve, reduce recidivism or homelessness or lead poisoning? Or do you want it to reduce the disparity? Or do you care about a balancing of these things? Those are questions that a vendor RFP never really has, right? Those are the questions that you kind of need to be asked, and you have to kind of figure out what process do I use to even figure that out? How do I tell this back to the vendor that I'm working with or the tool that I'm building or configuring? And then how do I test that it's doing it? That's kind of a piece that's often missing. So the next, just skip through next slide. I can go to the next slide. We can come back to this. So here's kind of the thing that we typically sort of use when we do these types of projects. Like we start with really kind of the obvious like requirements gathering. What do you want the system to achieve? And that's not a technical question, right? That's totally a policy question of what do you want the system, if you implement this 2 years, 3 years, 5 years from now, what do you want it to have done? And that's by far the hardest question to answer, because today it's all hand wavy. Right? We're not explicit. We just sort of have some policy and we hope that it kind of does. Second piece is then once you figure that out, it's like, how do we then build the system to achieve those? Third piece is, well, just because we built it to achieve it doesn't mean it actually did. So how do we validate that? How do we evaluate that it did what it was supposed to do? And then because these are not static systems, continue to monitor to see, does it continue to achieve those? Or was it a one-time thing that we did? And so that's sort of a typical process of, again, obvious, yet we typically kind of jump into building the system before trying to figure out, if you look at, typical processes, we don't have great processes for sort of the step 1 or step 3. We sort of just do 2, but 2 is pointless if you don't know what you're trying to do. Okay, so now I'm going to kind of run through some very quick lessons. So next slide. Okay, so this is the first, right? That again, despite what you hear, AI systems are not one size fits all. There is no single system that can kind of tackle, which means when you're buying, building, configuring things, you can't just buy an AI tool, right? You're going to have to sort of have a tool that's, if you're trying to use it to improve response times to citizen questions, that's a separate tool than if you're trying to use something to figure out who to prioritize for outreach. So even if you look at this one, if your goal, the example that I gave around we're doing around homelessness, the underlying system is identifying people who are going to be homeless. But the goal is not to predict who's homeless. The goal is to reduce homelessness and prioritize people for outreach to provide rental assistance. There is no such system. There's no generic homelessness prediction system. So the system is not trying to generically predict homelessness. It's trying to figure out a list of people who we need to prioritize for rental assistance to reduce homelessness. Those are 2 different things. And so that makes AI complicated, right? Because you can't just buy one tool and say, I'm going to use it for everything. right? So you were talking about sort of, Lawrence Livermore using Claude. Well, it may be that Claude is really good for one use case, but it's terrible for other ones. And we're already finding a lot of these tools, even within, if you're using ChatGPT for personal use, you have a drop down of 10 different models you could use. And you have no idea what model is good for what. And every day somebody comes up with like, oh, this model is really good for this one's really good for that. If GPT was this general purpose thing that was useful for all these things, why do you have all these different models that perform differently? So again, there's the marketing and then there's the reality. And the reality is that you kind of need to think about the use case first, which is, again, not new. That's what we've done always for any other tech products, right? So the idea is like, what are you trying to do? Who's going to be using this tool? When are they going to be using this tool? So, for example, one thing we were doing with in Chicago with both the health department as well as with the hospital system was identify people who are not likely to come back. Identify people who are HIV positive, that are not likely to be retained. They're going to come back and fill their prescription. If you're the health department, you're doing you're looking at the entire city and you're trying to figure out, who are the people that are going to be in that situation. If you're the hospital, you're doing it at point of care. You're doing it at appointment time. And those two are different systems. They're similar, but you have to configure them very differently in order to be effective. So we had to kind of design two slightly different systems, one for the hospital, which was more of an appointment time use case, and one for the hospital, one for the health department, who was doing it in a much more regular basis. Every week, every month, they would try to get a list of people. The list would go out to somebody who would then go out and start trying to find those individuals so they can kind of get them connected to the system. So next, I think there's an animation. I'm not sure, actually. If you go to the next slide. Okay, so the second is, sorry, the previous one. So this one is, AI systems generally tend to do what they're told to do. They don't really have a mind of their own, again, unlike some of the marketing. The problem is they need to be told very, very explicitly, and they're told in lots of different ways. They're told through the data that they're given. So if you sort of, the way you think about, again, if you take GPT, right, what GPT is it's been given all the content they could find. And what it does is it learns how to predict the next word. That's kind of the core capability of GPT. Now, that data that was given, that's kind of what was one way of telling him what to do. It says, take the data that you have. If it was just given articles from, papers in public health, then it would just know how to predict next words for papers. If it was just given news articles from New York Times, it would just do that. It's kind of been given everything. So it kind of has this hodgepodge of thing. But then that's not what ChatGPT is. So what they then did was they then got a bunch of people to ask questions to GPT and get answers. And they rated those answers as good or bad. And that's what made ChatGPT. So they took GPT and turned it into a chatbot. Now, the people they hired to do this, to kind of rate, those people were telling ChatGPT what to do. When they said this is more like what I want, it would go more towards that. And when it would make a mistake, then the engineers told it what mistakes matter more, what mistakes matter less. And so at the end, the system that was built was sort of told in all these weird ways, the data that was given, the feedback that it was given, and then the way it was told to reward or penalize mistakes or correct answers. All of those combinations of things told it what to do, which makes it hard to audit what it's been. We don't know what it was supposed to, because we have no idea. That's not disclosed publicly, right? So we don't know what it was designed to do or was told to do. So it is doing what it was supposed to do or was told to do, but we don't know what that was. So we can't audit it. And again, as all of you sort of, start or have been using it or testing it, without that knowledge, it's behaviors are not predictable because you don't know what it's told to do. You can only sort of probe it. You can't quite figure out, what it would do in certain cases. So next slide. This is so evaluation is sort of something, I spent a lot of time on. So I'll kind of, there are 2 or 3 lessons in evaluation. One of the things is today, the most common form of evaluation I'm seeing sort of state and local agencies doing is playing with it. That's what we actually just had so this is where the recording gets interesting. Hopefully nobody sends it out. We had the governor of Pennsylvania over here at Carnegie Mellon a couple of months ago, and he was announcing that they did a pilot with OpenAI, and they was announcing the results of the pilot. And the results were great. So they gave ChatGPT to about 150 employees for the state, and at the end for a few months, and then the end of that few months, they asked them, did they like it? And 89% of them said, yep, we loved it. And then they asked them, did it save you time? Like, yep, it saved me 4 hours a week or a day or something. And that was success, right? And I mean, I've said it to them, so that's not an evaluation, right? That is playing around with it. And what you found there is you can make employees comfortable using ChatGPT. You don't know if it helped them improve what they're doing because you never measured that. You don't know if it helped them serve the citizens better, the residents, and you don't know if it helped improve outcomes for any of the people they were trying to help. Now, ideally, you sort of playing around is really good because if you don't play around with it, you're uncomfortable with it, you're afraid of it, you're never going to get to the next steps. But you can't stop there, right? So I think what we need to do is sort of develop, actually not even develop, like we know the methodology to do these things, but we're not there at, across, and it's not just where we are with state and local agencies, it's also the same for companies. A lot of companies are really at the playing around using testing, but not necessarily evaluation stage. They're not really evaluating if it's improving outcomes for people compared to what people were doing before. So let me kind of give you a few examples of what an evaluation would look like, right? So if you go to the next slide, first piece is, I think when most of the tech companies that are developing these tools, what they're pushing for evaluation is off the AI model. What they're saying is, when I ask you a question, I'm gonna get an answer. Evaluate on the correctness or incorrectness of that question, of the answer, and that's troubling because most of the times this model isn't really being used in isolation. It's embedded in a larger process, right? So take kind of my lead poisoning example. When we actually deployed that model, that system, what it would do is it would take everybody who was born in Chicago over the last few months, 2-3 months. It would run it through the system, generate a list of kids who are high risk of lead poisoning. That list would go to a team who would start making phone calls to make appointments to do lead inspections. We actually noticed that we were not getting appointments. We were sort of missing people missing Hispanics. And so we started investigating what was actually happening. And we noticed was that the phone calls were being made in English. And we had spent a lot of time kind of making sure that the AI model was not biased, that it was being fair, it was including everyone, it was but the problem was not with the model, the problem was with the downstream phone call that was going in English. So when somebody who didn't speak English picked up the phone, they would just hang up and that appointment never made. And so the outcomes were not changing, even though the model was perfectly fine. And that's the same thing that's happening right now with a lot of these tools is the answer to the whole, if you go to the animation there, if you click there, is often the AI model is being given to, if you're asking a question, the answer could be right, but it could be presented in a way that you don't understand it. And it leads you to make the wrong decision, the wrong action. Or the answer could be wrong, but you figure that out because the answer is suspicious, because it's contextualized in a way that, yeah, I have a headache. What should I do? And then ChatGPT says, drink bleach. And you go and drink bleach, or you say, I've heard that before somewhere. And so the question there is, the evaluation of these tools shouldn't be about evaluating the AI model. It should be, you can do that, but what's more important is evaluating the overall system. And the AI model is a part of it, because if the AI model doesn't do what it's supposed to do, you can still mitigate that risk by inserting other checks and other things, contextualizing the answer, asking, for example, we're finding a lot of these LLMs, when you ask it something up front, it doesn't really give you the right answer, but then you sort of break it down and say, now tell me A and tell me B and tell me C. They start doing better. And they start sort of saying, oh, like I was actually playing around with something the other day, asking about, can you tell me some of the people who are alumni of this college? And they gave me this list. Like, are you sure these are alumni? Like, on second thought, these 4 may not be. And so, okay, can you tell me what year did they graduate from this school? It's like, oh, turns out these other 4 are also not, because I couldn't find a year of graduation. So what people are kind of coming up with are ways of kind of breaking, instead of, again, focus, if you add those kind of that scaffolding, those guardrails, you can deal with some of that. Even though the model is wrong, you can fix the overall problem by looking at it at a system level, as opposed to just focusing on the model. Next slide. I'm going much longer than I thought I would. So like here's an example of some of the work that, if we just focused on the model level for a lot of the examples that I gave, you would sort of say, well, how well does the AI model identify high-risk individuals, high risk of homelessness, high risk of mental health crises, behavioral health crises, high risk of lead poisoning? And that's great to know that it's good at that, but that doesn't mean it helps. And so when we run these evaluations, we do test the first piece, because if it doesn't do the first one right, it's unlikely to do the second and third. But the second one is the most important one, which is, does the model and this outreach program actually reduce the risk of somebody going to jail, or reduce the risk of somebody getting lead poisoning? And so we evaluate that piece. And then the third piece, we also well, it may not help everyone who you're trying to outreach. So does it help certain set of people more and certain set of people less? Because if it helps certain people more, then the implementation of this would be focus it on those people and then develop new programs and new models for the people it doesn't help. And that's kind of what we end up finding. If you click again, we sort of find, and this is one example from the work in Kansas of people who are using mental health outreach to reduce return to jail. We find that, the people we predicted who were in the top tier end up going over the next, when we ran a randomized controlled trial, it does identify them more accurately. But then more importantly, if you go to the next slide, we find that the people, it's really next again. I think if you click next one, so if you click one more time, it finds that the people who are the highest risk of going back to jail are the ones who we reduce a bunch of things. So we increase their use of mental health services, we reduce their risk of getting arrested, and we reduce their risk of incarceration. And so it was much more effective for high risk people than it was for medium and low risk, which is really useful to know when you're going to deploy or implement this program. So next slide, I'm going to go through things much more quickly. This is another one that when we do evaluation, we need something to compare against. Like, in absolute terms, something may be good or bad, but compared to what? And often we sort of comparing to reasonable baselines, simple things, or status quo. And this is something that because a lot of processes today are not measured. Like I was talking to a set of attorneys general recently, and they were all sort of asking about, how well does this AI tool work at doing these things? And I sort of asked them, well, how do you measure your judges' performance today? Like how, and they looked at me like, what do you mean judges perform? Like, well, judges are making these decisions around sentencing, around bail. What's the evaluation metric? We don't have one. But now they want to evaluate AI tools that are kind of supporting the same decisions but they don't have an existing process in place. And so a lot of times when we go in, we sort of do these types of evaluations of take the status quo and evaluate that. And then evaluate when you insert this AI tool in the middle, how much does it change? And then you have to decide how much better does it need to be to justify the investment in time and cost and effort of buying and building and deploying this tool instead of perfection, because none of these tools are going to be perfect, just like no human decisions are perfect. Next slide. This is one that I hear all the time from companies or vendors for these tools. They say, well, we have a human in the loop, so that makes it safe. Actually, I was talking to some reporter, CNN reporter recently, who was writing a story on, doing a story on a mental health, a chatbot that provides mental health counseling to high school students. And the premise of this company was, well, some large percentage of schools don't have the resources to have a counselor. They've built this AI chatbot it's much cheaper. And it's okay because they have this centralized set of counselors that are sitting, somewhere else, who review each response from the chatbot before it goes out to the kids. But again, there's zero evaluation of, one, they are monitoring 50 chats at the same time. Is it actually improving their things? And two, some of these, and we've actually found repeatedly, and not just lots of research has found that having a human in the loop isn't better necessarily than not having a human in the loop. And so the human by itself might be better than human plus AI. And the AI might be better, but that's not really the setting. We're not going to let the AI go by itself. We've repeatedly found that human or AI can be better than plus, because plus leads to a lot of like confirmation bias and lots of other things. So human in the loop, you kind of need to evaluate. Next slide. Actually, you can do the next click as well. So you kind of have to be careful about black box AI models, because you don't know today when you use a lot of these chatbots, you use them for tasks. At least I use them for tasks that I can verify the questions, I can verify the answer to. If I can't verify the answer, I'm not using these models. And so you have, if you're using them for things that you care about, then you kind of want to know what's going on. At the same time, today, a lot of these LLMs are not explainable. So anybody who sort of claims them to be explainable, you should be very careful and skeptical about that. So right now we're kind of in this limbo mode of, we want explainability in these models, but these models are not explainable today. They can tell you how they got what's called chain of reasoning, right? They can tell you how they got to an answer, but you don't actually know if that's the chain of reasoning they actually used. So you're kind of in this place where you can only probe them. You can kind of ask questions, get answers, ask for explanation, ask how they got there, ask it a different way, and kind of triangulate. But we're going to have to figure out how to deal with them, because they're not explainable. But you don't know how to sort of, so kind of, at this point we have to kind of wait until yeah, I think somebody sort of pointed out, yeah, AI community, they haven't figured out, this is something I'm telling you, that's not what the AI community is doing. They're still looking at the tiny little piece of the AI model. So we've been pushing for, actually, actually one side thing on evaluation is we have the center at CMU jointly with NIST, the National Institute of Standards and Technology, and it's around AI measurement and evaluation. And we're trying to kind of push a lot of the thing that social science has known for a long time. It's like, how do we evaluate anything, right? Policy evaluation, impact evaluation, program evaluation through randomized trials. So yeah, they'll eventually get there, but it's not going to come from the vendors. It's going to have to come from from everybody else. Okay, next slide before I'm out of time. Let's just skip that. This one is important. We're not going to have time, but I think procurement is sort of one way we can fix a lot of these things by getting it right at the procurement stage or by getting it wrong. Generally, in my experience, state, local, and federal agencies, when procuring machine learning, data tools, AI tools, have gotten more wrong than right. The people get stuck in long-term contracts that they can't get out of. People get stuck in contracts where they can't it's too expensive to get new data and integrate it in there. It's too expensive to get it out, so they're locked in there. So we've really struggled with getting, a lot of these RFPs that I see focus more on kind of, can you log in? Does it start? Does it, do what you, kind of mechanical things rather than policy outcomes and people outcomes. That's rarely written down into the procurement process. That kind of comes in much later, and it's too late by that time. So procurement is a huge, and there's sort of few resources that are coming out that are around. There's a GovAI team that's, I think San Jose has been a network, and they've been kind of building a procurement guide. There's some other resources that I have in these slides as well. And then last thing I would, let's see. I think, I can skip that. I think there's people I can look through. And then, I think we're out of time, so I'm gonna skip this part, but I have slides, I have sort of links here that kind of go deeper into that around bias and fairness are going to be issues with these types of tools for a while. Like, that's not going to get fixed. And so I think the only thing I would sort of say here is be very deliberate and proactive about, there is no kind of generic simple solution to dealing with it. You kind of have to think about what do you even trying to think about, what do you mean by bias and fairness is an issue. And so we've sort of, there are more resources in one of the slides that have links that kind of go deeper into how do you think about defining it, measuring it, understanding it, what the root causes are, how do you improve it, how do you mitigate, things like that. So, and if you skip through the next few, it's the same slide that animates. That's a case study that I was going to talk about, but we don't have time, so we can skip through that. Okay, so the positive side, these are all sort of cautionary notes, right? The one, what I sort of think about today's AI is it's a great Trojan horse to fix a lot of the problems we have within the tech problems we have within a lot of our state and local agencies, right? It's a shiny new tool. Everybody, your bosses are saying, what are we doing with AI? We need to do something with AI. And there's budget at some levels to do this. So use that excitement to do what we need to do already. Like, we need to do data governance. We need to integrate things. We need to document things. We need to baseline what we're doing today. What does the current performance look like? We need to develop monitoring tools. We need to have governance that are across data sharing across agencies, between city, county, state. That doesn't happen, and could, having transparency, engagement, things that are kind of only the more committed and progressive organizations do. I think this AI is an excuse to do all of those things, because there is interest today. And I mean, as I sort of said, when was the last time a governor announced a result of a tech pilot in a press conference, right? So that's kind of what we've been working with them. We're kind of done the same thing. Hey, you have the buy-in right now, and you have the budget and the interest to use that to do all of these things. You still need a data infrastructure. You still need training. You still need skill building. You still need all of these other things. Use the AI excuse to do all of this, because you can. So anyway, I went much longer than I expected. There are more links in these slides for content, for things, but I'm also happy to, I don't know if people want to stick around, I'm happy to take questions, but also I'm happy to chat offline with people who are interested.
Sure, thank you